HealthBreak is brought to you by South Central Regional Medical Center in Laurel.
Arthroscopy was popularized in the 1960s, but even in the last 10 years, it has vastly improved the way orthopedic procedures are done. Dr. Richard O'Keefe Jr. explains the advancements by describing how the surgeries were performed just a couple of decades ago.
The surgery would actually have to be done through a big incision because you had to be able to look inside the joint to see the part that you were working on. And then you had to be able to get your instruments in there to do the operation that you needed to do. Nowadays, we do many of those operations arthroscopically, which means we use an arthroscope. An arthroscope is about as big around as a number 2 pencil. It's got a camera lens on the end, and it has video cables that go to a television screen.
The arthroscope is then inserted into the joint, such as a shoulder or a knee, through a very small incision.
And it can allow me to see the inside of the shoulder or the inside of the knee just as well as I could with a big incision that opened the whole joint up. While I'm looking with the camera, I can then take another device, again about the size of a number 2 pencil, but instead of a camera lens on the end, it's got a little trimming blade or it's got a working tool. So while I'm looking with the number 2 pencil camera, I can take the other device and do the work on the inside. So the operation that we do is the same operation on the inside that they used to do through a big incision, but now it's done through smaller incisions with much less trauma to the joint. We have excellent arthroscopic techniques available here in Laurel at South Central Regional Medical Center, and if you need it, come see us.
For more information about arthroscopic surgery with Dr. Richard O'Keefe Jr., call 601-649-5990 or visit scrmc.com. For HealthBreak, I'm Catherine Farah.
HealthBreak was brought to you by South Central Regional Medical Center in Laurel.